So here, after we go to the NMC, Nurse Midwife Council, here we can see the practice test. This is the part B for the adult nurses. Select your exam. This is for 75 minutes. We need to complete it off. So first question is, which of the following describe a quantitative method of research? Remember, the quantity means the number. Quality is something which is like expressing their quality, but here the quantity. So the options are exploring a phenomena by interviewing participants, collating people's view and opinion, collection of numerical data, reviewing published research. So collection of numerical data will be the correct answer. Then the next question, choose the 4 themes of NMC, the code. Choose the correct answer. So here the options are as prioritizing patient practice within your limits, preserve others, promote well-being. Second option, prioritize people, practice effectively, perceive safety, promote professionalism and trust. Prioritize staff, practice safely, preserve well-being, promote health. Then the next is promote yourself. No, we are not going to promote ourselves, so we can just eliminate this one. So prioritize people, practice effectively, preserve safety, promote professionalism and trust. So this might be the correct answer. Yes, this will be the correct answer. Okay, this is the code of NMC. When you are caring to the patient who is Jehovah's Witness, okay, means some spiritual kind of person, suffering a severe hemorrhage, what do you consider in this case? Means hemorrhage, the patient is having severe bleeding. Okay, in this case, what you will do? The options are, they are not to be sedated. There may be severe pain, so they not to be sedated. Second option, they are to be cared for professionals who are also Jehovah's Witness. No, they cannot able to take care of the patient. Only the healthcare professionals can take. They are not to be resuscitated. No. In most of the cases, if blood loss is there may be possibility of shock and patient will be having decreased respiratory efforts. So they are not to receive blood or blood products. Okay, this might be the correct answer, because if patient is having already the hemorrhage, we need to just hold on the transfusions in order to assess and know what's the patient status. When caring for a patient who does not speak English, obtain. Remember, when there is any language difficulty, in order to communicate, have always translators. So check with the translator, family member, translate face to face or online. So this will be the correct answer. Then the next, when a drug error have been occurred and also you have assessed for any harm, what can be your priority? Always remember, when there is an error and you have assessed for harm, inform to the patient. Check with the options. Continue to administer the next dose, continue your drug round, inform the patient what had happened. Okay, inform the patient what actually had happened, so that the patient will be aware and you can just take off the next steps. The human papilloma virus vaccination prevents which diseases? Usually HPV helps in preventing the cervical cancers. Okay, we need to eliminate the rest. Which of the following professions are specially trained for cessation? Which can be the thing? Hypnotherapist, chiropractor, dietitian, pharmacist. Pharmacists are usually trained in smoking cessation. Okay. Which of the following disease is notifiable to Public Health England? Usually for Public Health England, we need to inform the mumps. Mumps is a disease which we need to inform immediately to the England public healthcare. Which of the following is a health visitor's responsibility? When we are going to assist the patient on visit, our responsibility will be support the physical and emotional growth of a child. Yes, supporting, because emergency first aid is not given by general health visitors. administering immunization, assessing speech and language development, it's all in another sources. But healthcare visitors' responsibility is supporting physical and emotional growth of a child. Oh my god, I have left one more. Okay, so what are the common complications of uncontrolled blood glucose levels in diabetes patient? Means the sugars is not going to get controlled and the patient is having diabetes. So what can be the complications? Yes, there will be retinopathy. Good. Retinopathy, memory loss. No, memory loss is not related to diabetes. Peripheral vascular disease is related, but irritable bowel is not related to diabetes. Retinopathy, peripheral vascular, okay, and renal failure. Yes, this might be renal failure. Joint pain is not related to the diabetes, so eliminate. So this might be the answer. A doctor requests lactate test to be taken for very unwell patient. What sample you will be collecting? Full blood count is not related. Urine sample, no, lactates are not checked in the urine sample. Stool sample also lactates not checked. Yes, blood glucose, blood gases, either the BBG or ABG will be assessing with the blood gases. Scale 2 on the news choose chart is used for which group of patients? So those who have been exposed to carbon dioxide retaining patients, those receiving IV therapy, no. Urinary catheter, no. Carbon dioxide retaining patients, we use news 2 chart. Okay, patients with chronic pain conditions are screened for which of the following? Screened for low mood and depression, schizophrenia, not with the schizophrenia, coronary artery disease, chronic pain conditions are screened, bowel cancer. Whereas the patient will be very expressive in the case of bowel cancer as well as the coronary heart disease. But the thing is, in the low mood and depression, the patient cannot able to express properly because of their depressive behaviors. So we need to do the screening. Which of the following group has the highest rate of suicide? Women have moderately, men's are more, elderly over 75, not much cases, under 18, not so. So men's are having the higher rate of suicides. Patient presents with a productive cough, low saturations, high respiratory rate, raised lactate. Lactate is raised. Remember, the lactate is usually with the infection. Okay, high levels of lactates will be with infection. With news 2 of 9, which of the following does indicate? Sepsis, obstruction, MI, DVT. So might be possible sepsis, isn't it? Because remember, okay, so the chest sepsis is the correct answer for this. Let's see next. Prior to surgery, how long? Oral fluids. It's not talking about NPO, nothing per oral or complete oral. We need to hold on, or solid and all. It's asking oral fluids. Okay, the patient can take oral fluids till last 2 hours before surgery. 2 hours before can take the oral fluids, but any eatables can be hold before 6 to 8 hours, right? In order to prevent dehydration. What group of drugs are used in patient control analgesics? PCA, in which we keep the medications with the infusion pump, right? Patient control analgesics, where the patient will be taking the analgesics opioid based on their severity of pain. Furosemide, one common side effect. Furosemide common side effects, polyuria, isn't it? Not so definitely the polyuria will be the answer for this. Then the next question, you have a patient who is choking. Okay, you have administered five back slaps, means after telling the patient just 5 back slaps you have done with no success. There was no success. What is the next step you will be taking? First, we will be giving the back slaps. After that, immediately we need to give the abdominal thrust, right? Where is the abdominal thrust? 5 back slaps, no. Basic life support, no. Monitor the patient, 5 abdominal thrust. Okay, we will be giving 5 abdominal thrust. Good. Then the 20th question, you are caring for a patient who has a stoma formation and they are ready for discharge. What advice you will be giving to the patient in this case? Using perfumes or air deodorants, this is secondary. Keep the stoma moist, no. If there is a moist, then it cannot able to stick with the adhesive of the stoma bag, right? Wait until the bag is full, change it, no. Once the bag 3/4 is filled, we will be changing it. Clean with water, trying to keep fecal fluid away from the skin to minimize irritation. Yes, this might be the correct answer. What is the responsibility of an occupational therapist? Occupational therapist responsibility is, we need to just eliminate the incorrect answers. So here, assessing some ability to see, no. Adjusting prescribed medications, no, that's the responsibility of the doctor. Assessing injury or damage in the patients, no. Supporting people, yes, they will be supporting. Occupational therapists usually focusing with the job and their financial issues. Supporting people, help prevent from completing their normal activities, yes, they will be seeing this all. Occupational therapist. Whose role is to lobby the government to support nurses and make positive change profession and working conditions. The nurse union, HR department, no, HR not responsible for positive changes. Chief is executive of the trust. Trust is not responsible for the positive changes in the working conditions. Individual teams of nurses, no. Union nurses. What does it mean to performance manage an employee? Remember, with performance manage, what do you mean by this? Developing a person to fulfill the expectations of their role. When performance is exceeding the expected level. When someone is being dismissed from their workplace, no. When a person is promoted. So, performance, developing a person to fulfill the expectations of their role. Managing the performance of the individual by fulfilling the expectations of their role. Hence, the next question is, when running a ward or unit, which of the following is the priority to start up the shift? Remember, when we receive a patient after the endorsement, immediately go to the patient and assist, calling up, updating family or carriers, patient condition, no. Check the staff members, match patient equity, okay. To give out breakfast, this is secondary. Make sure the doctor is on the ward, no. So, checking the staff number matches the patient's acuity level. When supervising a nurse student, when do you deliver feedback? Feedback is provided by the university. No, this is the last summative evaluation we will be submitting at the end of the placement. Continuous throughout the placement at the midpoint. So remember, here we are supervising a nurse student. So for the nurse student, feedback will be given continuously throughout the placement till they will be placed on a particular fixed job. We will be giving the feedback, which is the whistleblowing policy, a government lead policy that advises trust on care. A policy that requires the staff on raising concern about the safety and practice. Okay, we will select this option. Next, go check out a policy that helps employers manage staff. No. Major incidences policy, no. Here, whistleblowing policy always helping the staff to raise their concern about their safety and their practices. Move on to the next question. When understanding research, what is the first step? Remember, the first step of the research is the selecting a topic. Collecting data is secondary. Applying for ethical approval, this will be ethical approval. Once our topic is selected, later it is for ethical approval that to continue our research or not. Recruiting a team of people to help you, this is later after once our topic is finalized, right? Okay, what is the main purpose of a root cause analysis? The main purpose to provide data for the incidents of the department? No, this is not the purpose of RCA. To assess it, if those involved require compensation. To identify who was responsible for the incidents, manage problem to ensure that recurrence is avoided. Yes, the main purpose of finding out the root cause analysis, RCA, is to ensure that reoccurrence is avoided. It must not be repeated again. Who will notify an emergency department that a major external incident has occurred? Who can be notifying? Nurse in charge of the department? No. Okay, the nurse in charge, how she can come to know that there is an external incident happen? The reception lead also will come to know once the patient have been arrived to the ER or emergency department. Ambulance service lead, the hospital press. Yeah, ambulance service lead will be notifying the emergency department. Move to the next question. When noticing that a colleague is suffering from low mood and depression, what action should be taken? This is like a team. Okay, when we are working with our colleagues, refer them to occupational health without discussion. No, as that is my colleague, I will be discussing. So eliminate this. Provide support and guide them to the well-being. Okay, select this option. Contact their next kin and discuss. No, we will not discuss. We will be just interfering with the patients or the. We should never ever take the others to discuss with the regarding the person's condition. Inform their managers without telling the colleague. No way, we are not going to interfere with the person's privacy. So we will be supporting our colleague and guiding them to well-being services. What has been implemented to ensure that nurses are fit to care holistically for patients with a variety of conditions? Royal College of Nursing online modules. It's for all the nurses. So we are talking in general, not with one particular college. Ensuring students have math, English. No, it's not related to English. Implementing to ensure fit for holistic patient care. So it's not related to any English. New pre-registration educational standards. Okay, can be suspected answer. Preceptorship training. So this will be the. Who is in attendance at a child protection cares conference? The team supporting the parent or care only? No. Social service only? No. All those who involved? Okay. Health service only? No. All those who are involved with the family for health, education and social services are involved to be present at the case discussion. What document could help a nurse understand the preference of a patient with dementia? Remember, the dementia will always have a card or a board. This is me document. Okay, patient drug chart, no. Most recent discharge summary, no. Handover sheet, this is the S bar what we will be taking for the handover sheet. But how we can understand the patient preference with dementia is this one. A document, that this is me document. Who should be notified when attending hospital with a school child age 8? Choose the correct answer. Police? Nowhere. School nurse, public health nurse, nurse team, local children's center, school teacher. Okay, just fine. School nurse, public health, community nurse will be informed. There is a requirement to increase nursing staff on a ward due to increased patient demand. What steps are taken? Choose the correct. Reduce the number of patients admitted in the ward? No way. We will not be reducing the number of patients. A business case is written to increase nursing staff number. Business case is written. Okay, ask the team to increase the working hours. We cannot ask to the team to work more than the required hours. Go directly to the HR? No way. We cannot go to the HR directly. So here we can just write. So what is the following is a framework used to identify areas for development. Area of development, if analysis is come, it's always the SWOT analysis, that is the strength, weakness, obstructions, outcomes or objectives and the threats. So SWOT analysis is the correct option. Then, according to the Rogers theory of nursing, describe the core condition to effective communication: sympathy, respect, regard, spiritual understanding, sympathy, congruence, empathy, respect, honesty, congruence, empathy, and respect. Rogers, okay, effective communication, congruence, empathy, and respect. We always need to have empathy and give respect with the congruence to the patient when we are discussing or having a. Motivational interview. Interviewing is best described as a tool used in the peer supervision, a method used to encourage people to adhere to discharge advice, a tool used in appraising staff for development, a method of assisting people with health behavior changes, a method of assessing people with the health behavior change. So what can be the answer for this? Motivational interviewing. Remember the motivation. We are going to motivate the individual by interviewing them. So it's not a tool, it is a technique or the method. A method used to encourage people to adhere to discharge advice? No, not a discharge advice. Yes, it's a method but not a discharge. A tool used appraising? No, this is not a tool. Motivational, so usually this might be done by the doctor, okay, answering. So ensure that range of, we are going to ensure to the patient that range of various materials like leaflets, pamphlets are available, and also they can take home after the consultation with the doctor. Next, ANTT refers to choose the correct aseptic non-touch technique, antiseptic touch technique, aseptic non-transmission technique, aseptic treatment. Aseptic non-touch technique usually we follow at the time of making the sterile field for the surgical procedures, right? Which of the following is not considered to be an aerosol generating procedures? Blood transfusion. Blood transfusion, yes, this might be. Once we'll go to the next. Mechanical ventilation, no, this is highly aerosol generating procedure. Oral hygiene, all the oral hygiene, oral medications. Wheezing is commonly heard on auscultation. In which of the following? Wheezing, pulmonary edema, no. Pleural effusion, friction rub will be there in the pleural effusion. Pneumothorax, slow sound will be there. Acute asthma, this might be the case. This usually in asthma we will hear the wheezing. Hematemesis, emesis refers to which of the following condition? Emesis, always remember emesis. Emesis is the vomiting. Blood in sputum, blood in urine is hematuria, not there. Blood in vomit is, okay, this might be blood in stool, occult blood and all will be there. Have I selected the answer? You see, the answer hematemesis, vomiting, blood in the vomiting. When caring for patient at the end of life, a family report that they are concerned that the patient is suffering from dehydration. What actions is taken? Advise the family this is common symptom that unable to resolve. No, we cannot inform to the family like this. Ensure subcutaneous fluid are commenced. Okay, subcutaneous fluids. Ask the family to encourage oral fluids more regularly. No, patient is at the end of life. Cares, start measuring urine output. Whatever you are measuring, there will be not much urine output because decline in the system's function. So ensure subcutaneous fluids are commenced. A person over the age of 70 with a respiratory disease is encouraged to obtain which of the following immunization? 70 years means elderly patients are encouraged immunization. Meningitis B. So the person over the age of 70 with the respiratory diseases is encouraged to obtain flu vaccines. Okay. Then what medication is given to someone to prevent long-term? Antibiotics is given for infection, paracetamol for the pain, but here it is ischemic stroke. Ischemia is there. Okay. Clexane will be given in order to prevent the blood clots to get formed, whereas thrombolysis will be given for the old stroke. Means already there is a blood clot. Okay. Then when discharging an adult with an acute wound, who is the patient referred to for wound care in the community? To whom we will be referring? To the district nursing team, not to the local community hospital or GP or local emergency department. District nursing team will be reporting. Research suggested that the majority of in hospital cardiac arrest can or would have avoidable. So this lead to the introduction of what early warning signs or the early warning scores, Liverpool care pathway, sliding scale, that is reporting. So national early warning score. Okay, this is me document is implemented to aid in care for which patient groups. So usually in the case of dementia they will be having their this is me document. Okay, so dementia, let's look on. So this is how we have completed all the 50 questions from the part B of clinical practice of CBT adult nurse. Okay, hope it's clear and fine to you. If you have any queries, please leave your comments in below. Thank you so much for watching till here. So here are the one more we can able to attend the part A questions. Adult nurse part A, numeracy.